So we wanted to have a short discussion about the determination of need, regulations, and revisions that are happening. I believe we sent everybody on our list links to the new regulations and the hearing schedules and those. They're all available on the DPH website. So as I said, I don't represent the Department of Public Health. Have no intention of doing that. But I thought, because I've been involved in some of these discussions, that I'd give you my take on what's going on so that you know how it might affect you and what you can do to try to affect the ultimate regulations. So the handout that you have here, this is the Department of Public Health did this, trying to explain what the current DON regulation says, and then what their proposed revisions, how it would change things. As you'll see, most of it has to do with the hospital's application to get a determination of need in terms of building a new building or buying the MRI machine, which, while it affects our communities, I think is not where most of us in CHNAs put our focus. It's more on the community health initiative that comes from it. But I wanted to ask, how many of you have funding other than determination of need funding?
Oh, wow.
Okay.
We don't have any funding.
We don't, besides no funding.
Yeah. So this is not a shame or a scold, but I think it's an indication of if CHNAs are going to continue to exist, you're going to have to look for funding beyond determination of need. Not that it's going away, but this is just my take on this. So the new regulations have been posted. They have held a couple of public hearings about the regulations, and public comment period, I believe, ends October 7th. And you can submit in writing your comments. They state that they read all the comments. And as I said, the part about building the capital improvement has some changes in it in terms of timing, the connection between the application to get your determination of need and what the community health initiative is. And I'll just tell you my understanding of it. Basically, the new regulation states that the planning for the CHI, the Community Health Initiative, has to happen prior to applying as part of the application to get your determination of need approved. Now, technically that's always been the case, but as some of you know, sometimes what DPH is allowed is sort of what they call placeholder language, so that it'll say, and so the hospital and the CHNA and the planning partners will meet, and it may be very general, or it may say to decide what the priorities are. This basically says you have to have your CHI worked out. Now, from
CHI, please.
Community Health Initiative, that's the money that goes to CHNAs, if you get any.
So the hospital has to have a community health initiative already planned? I don't understand what that means.
Okay.
The details.
So, yeah, it means, so, just to clarify in case anybody doesn't know, the Community Health Initiative is funded by 5%, the equivalent of 5% of the capital expenditure of when the hospital builds a building or whatever. makes,
Is this like
there's a floor amount that you have to spend to be under this regulation. So part of the regulation proposes that how the community health money will be used has to get figured out prior to getting, it comes as a package. As opposed to what in the past has been that it's gotten approved and then the planning partners, the hospital, et cetera, figures out how they're going to spend the money. From my perspective, one of the problems with that is that already there's been quite a lag between when something gets decided and when it actually gets implemented, because the hospital is not required to start paying until the project is completed, the physical project. So this means it makes it even further out. So you may be 3 and 4 years between what you say the need is and what gets implemented. So I've commented on, we've commented on that, and
I
said
thought it was kind of close together, like the package. You get the DON approval and you're required to do the community health improvement plan. So I thought it was attached.
yeah, it is
Oh,
attached.
yeah, yeah.
But what I'm saying is that in the
Timing.
past, for instance, the Brigham and Women's Hospital has a DON that they're about to start paying out, but the DON it got approved 4 years ago.
Oh, the project took that long to finish?
So that's one thing. And one other change is that if, and I think the hospitals are probably going to oppose this, I don't know if it'll change, is that, and I forget exactly what it's called, but it's basically renovations and updating a physical plant, which was not included previously, would be required to pay 2.5%. And the hospitals are opposing that. But,
So they take our hospital at Mary Lane, Bay State Mary Lane, merge the license with Wing Hospital in Palmer, and they're going to upgrade that ED, and we're only going to get 2.5% of that upgrade? Hopefully.
Maybe.
Before it was nothing.
So, I don't want to dwell on these things, because A, it's not something that I'm an expert
Just a
at.
message.
Yeah.
Did you send this out?
I think we did, yes.
So this is, this is confusing, but we need to read it. Right?
Yeah, yes.
So, I read the regulation, or I tried. Kim and I actually talked about it a
Congratulations.
little bit, trying to parse through. We sort of came to the conclusion, and the language was so tricky, that the money, that a CHNA could still get funding, but they'd have to compete the same way everybody else would. It would almost be more like a grant process. Did other people interpret that?
So here's
We couldn't.
here's where the, as they say, the devil is in the details.
Right.
So there is this regulation, and then there's reference in it to sub-regulation guidance. And, right. Did you go to law school? So and the two sub-regulation guidances that they're trying to create is one, what the health priorities should be for the use of this money generally. That's one. And the other is what they say, what should the gold standard for community engagement be? What does it mean? You're right that at the moment, there's nothing in it that refers to CHNAs. CHNAs don't exist in it. But what they will talk about, I'm sure, is, and what I'm encouraging you to do to weigh in, is the importance of a cross-sector, community-based coalition being part of the planning of the community health initiative. In Boston, we used to get money from the hospitals and redistribute it to community groups the way I think a number of the CHNAs do. In the last couple of rounds, that's kind of not happening. They're having their own RFP process, and granting the money directly.
The hospital?
The hospitals, yeah. So, there are going to be 2 or 4 hearings, is it, Andrea?
4.
4 hearings during October to hear what you think the health priorities and what the community engagement standards ought to be. One of the things that they're pretty clear about in terms of health priorities is that the CHI money should be used for some combination, and they haven't quite figured out the weighting of it, of the community health needs assessment that the hospital has done, because hospitals have to do that every 3 years to identify what the community needs are. If the municipality or a set of towns has a community health improvement plan, that goes into the mix, as well as what the community says are important and some process to go through that. But exactly how it's going to get measured, not clear. But I guess what I want to say is, from my perspective, CHNAs, if you have a CHNA that works and meets the standards that they're going to set, you're in good shape to be included as part of the planning process. But it's not automatic, and so that's why I think it's very important to to weigh in either at the hearings or in public comment. And they state that both, as I said, both written and oral testimony gets equal weight. And I think so. The idea is that they'll have these things in October. They'll come up with a draft in November.
Actually, David, I was just looking here, on October 5th, that they will be releasing a preliminary framework
Yeah.
of the guidelines on the 5th.
Right. And so these listening sessions are about commenting on that.
Yeah.
A couple of us have been contacted by DPH to give our opinions, and they say they've talked to scores and scores of people.
Sarah,
Yes,
how much are they collaborating with the DMH?
not at all.
So this is totally independent of the behavioral health component of community.
No, it just means that, am I overstating that?
No, you're right.
Yeah.
DPH has no jurisdiction over mental health facilities, so their regulations don't apply to mental health facilities. And I'm sure there are some hospitals that are involved in mental health care, but this isn't directed towards those parts of the hospital.
But community health that's about behavioral health and substance disorders and all that are perfectly within the realm of what gets funded. Yes?
So, seeing that a number of hospitals around the state are no longer choosing to direct their funding through CHNAs, hearing that no CHNAs in the room are receiving funding outside of DON funding, what does that mean? And that the CHNAs are not being written into the new regs?
Wait, can we go back to your first statement? Hospitals choosing not to direct the DON to CHNA? Is that what's going to happen, that the hospital's going to have a choice not to give it to the CHNA?
Right.
Or is
Right
the
now they
hospital
don't.
going to have to go through the process which CHNAs will apply and may the best man win?
Well,
It isn't like they can say, we're not giving money to CHNAs anymore.
No, no,
CHNAs
no.
meet the qualifications.
No, but I know that in some communities,
Some communities they already are.
but
So
what I'm saying is
Salem
that in
Hospital
some
is
communities
already done that.
in the history,
Yeah.
historically, the hospital has given the money to the CHNA, who then
Right.
decides how to
But it was,
Right.
it was never a ironclad policy
Right.
that CHNAs would get it. It never
Right.
was.
No, I know.
It never was.
Okay.
But it was sort of an informal policy
Right.
under the previous DPH administrations
helpful.
that it was
What
changed.
Yes.
I just want to understand how many have this fund that the hospital is holding on to versus moving to CHNA. Does anybody have that situation? The
Salem.
hospitals, yeah,
Is Salem, partner Salem Hospital is.
partners. So do you think partners is starting to do it? It's just
Well, part of the new regulation says that the application needs to come from the hospital system, not the hospital. So that, because they're trying to, because it is theoretically all about cost containment. They're trying to look system-wide, so the whole partner system.
And GPH has to approve the plan, right?
Yes, yes,
So that part's the same.
yeah, yeah. It still goes to the
Still have to come
public
up
health
with a plan
council
and.
for approval.
So could you come up with your own plan and DPH would approve it, and then they would have to fund it?
No.
The hospital can't come up with their own plan, because the hospital can't fund themselves.
No, I don't mean them. I mean our community, say we, by various means to be determined, we made up our own plan based on our own needs.
Well,
That's not what the CHNA is.
that's part of what the CHNA is, and it's, that community health improvement plan, which is an official way to describe it, is supposed to be incorporated in what the priorities are for the funding. Yes?
So if we're talking about aligning more closely with the community needs assessments of the hospitals,
Yeah,
since the funds are coming from them,
right.
does it mean that, I guess what Jenna was trying to say, do you think that we need to do a lot more specific planning on the allocation of those funds if we were to apply as a coalition, which is the CHNA, for the funds? We need to be very specific about what we would do with it. Let's just say, maybe goals or maybe activities. I don't know how we'd want to frame it. But do you think that DPH has some certain outcomes they're looking for that are specific to how we would go through that process? Or is that what they're trying to figure out now?
That's what they're trying to figure out now.
I
Yeah.
think that's a great idea. In other words, to regionalize CHNA
Well,
or make it democratic from the grassroots.
But I think
Into
DPH,
one-
if we give us a framework which we can apply to, we don't really know the rules right now.
Right, because the
So
rules
we
are being
can't,
written.
right, and so we can't apply and say, oh, we're equal, partners in games. So I think that's the
Yeah.
issue here, is the rules aren't written, but we still need to apply, and what do we apply if we don't know the rules or what the rules are?
Right,
Rules
so-
are very unclear
And-
before.
Yeah, but there was a lot less,
Yeah.
like, they were unclear before, but now they are requiring some things for the CHNAs to do upfront that they weren't requiring before, that I think that's what makes it especially hard.
Yeah, it's difficult. So for instance, in Boston, where we have joked in the past that if you've seen one DON, you've seen one DON, because each process seems different.
Yeah.
And I think that's something DPH is trying to change, to kind of have it be similar across systems. In the Brigham and Women's DONs that is going to start paying out soon. We, as the CHNA, were one of the planning partners, and we and a bunch of other groups at the hospital went through a process. We actually we had lots of time, so we created an online game that got 900 people to participate in prioritizing. They had the hospital community health needs assessment. They had the city health improvement plan that we helped to write. And they came up with 3 areas of priority for funding. And then, they were psychological well-being, job readiness and employment, and I forget how it was phrased, but something around racial and ethnic health equity. When the priorities were set, they then decided, they then went into a RFP process. We had to drop out of the RFP process because we wanted to apply for money. And it would be a conflict of interest, which, as you all know, has been built into this system from the very start. You help plan how the money is, it gets used, and you get it. So this is an attempt to try to separate the two pieces. One concern that we've expressed and will express more about community engagement around the health priorities is that if you ask people, in community meetings and whatever, what are the health, the issues, what are the priorities, nobody is going to say capacity building for cross-sector coalitions, which is essentially what the CHNAs are. So, and as you know, capacity building has been one of the allowable uses of community health initiative money. So I think it's really important that you voice your strong feeling that needs to be a part of
What does that
health
mean?
priority.
So you
Well-
can build the infrastructure of your CHNA with some of the funds. You could pay for support as a coordinator or
Yeah.
training or whatever you need to function.
Yeah.
Which is, so what is the percent now of, that's allowable? Is there a percent?
No.
No.
Uh,
I've never been able to find any.
No, it's always been guidance, and this will, I think, continue to be guidance.
So what does it actually say? Just a portion can be used?
In the current one?
Yeah.
In the current one, it says, it just has a list of allowable uses, but without percentages or anything.
I mean, we
Well, I mean,
see, in 17, we see our planning director, which is what we call our coordinator now, she does the actual work. So we don't see it as capacity building or whatever. That's part of the health initiative. She does that work.
Yeah, and I
Also, if
think.
we're gonna apply for funding,
Yeah.
you need somebody who can do that. I mean, if we have to be self-perpetuating in some ways, if we, you need infrastructure staff.
And
to do
that's
that.
why I think, it's important. I mean, I get paid also, and I do a lot of work, but I'm also, I do budget and all that stuff. That's why if you don't have a cross-sector coalition, it's hard to do this work. And that's, so I think part of it is stating clearly when you register your opinion, the importance of including support for cross-sector alliance, particularly since they've said that health equity and social determinants of health will be included as areas that can be funded. And if you're not a cross-sector alliance, why should we give you the money to be able to do support affordable housing or whatever? So these are all my opinions. Yes, David.
If you could elaborate on that piece saying that they'll still allow the SDOH type stuff, because it's something, when they start talking about, we think we've given all this money away and haven't, we can't measure outcomes, makes me think that they might just come out and start looking at more narrow, disease reduction type indicators only. But it's pretty definitely that they're going to have that social determinant stuff, or is that something we need to advocate
It says
for?
something in the proposed regulation about it, but I would urge you to, if you do make public comment, to emphasize the importance of that. Somebody else, yes?
I was gonna say, I worked for a corporation that gave away a lot of money, okay? And in the early days of the corporation, we gave money, whoever happened to bump into the president in the hallway. So what we did, and I suspect this is what the hospitals are doing, that we finally said, we have to figure out where this money is going and why it's going. So I think hospitals, as they've condensed now, they're probably looking at that. So the initiative probably coming inside the hospital is almost like a foundation. Like we gave away so much money, it was like a foundation. They may look at this DON money as like a foundation, and they're gonna kind of say, what, like the Gates Foundation, think about it, we're gonna be on immunization. We wanna come down to, based on evidence, these are things we're gonna, kind of back. So that might be the conversation that's going on, because we're not, Partners is not a small hospital, it's a huge, and they have a foundation. So they may be starting to pull back and saying, our foundation's goals are this, this, and this within the community.
Well,
So-
within the determination of need, though, where was I going with this?
It's not such a horrible thing if the hospital is actually doing their homework
Right.
and figuring this out and having a good, community health assessment and working, in partnership. So it's not such a
Yes,
bad thing.
absolutely.
Because it does kind of get set up like adversarial. The hospital just has, all they're doing is putting the money in.
Right.
And as we know, hospitals
Right.
don't like to be seen.
Right,
in
and so,
ATM.
I mean,
Right.
the money can't go to the hospital, but
Right.
it can go to things that would make, improve their bottom line potentially.
So two things that I wanted to add. One is, when they talk about community health and population health, I think it's really important to emphasize that when we say population health, we mean geography or an identity group. We don't mean just the patient panel of the hospital.
Right.
So that,
Very hard to get away
Right.
from that.
right, but I think that's important to emphasize, because otherwise, if the money is used only to support, to improve the health of the current patient panel,
Right.
whatever inequities currently exist about who they serve and where they,
Right.
what they do and where they do it, just get perpetuated.
Correct.
And the other thing is that in the regulations, there's more specific talk about accountability in the hospital. The hospital is going to have to report more specifically on the outcomes on a yearly basis, more so than they've had to do in the past. So,
Yeah, we just had a public health hearing, September 1st, about the closure of beds at Mary Lane Hospital in Ware. And we had to have our DON. And they ruled, thanks to a year's advocacy, that Bay State Health has to do X, Y, and Z on an ongoing basis. But, public health doesn't have any clout, really.
Well, that's why we're trying to
Right.
build
Build it in the regulations.
The other thing I wanted to just mention is you probably read about the DON for Boston Children's Hospital. How many of you have heard about this one?
No.
It is by far and away the largest DON ever. It's over $1 billion cost of the building in Boston and another building in Brookline that they're proposing. It will yield $53 million in Community Health Initiative funds. They've been going through a planning process primarily in Boston, but one of the things that I know DPH is considering is funding through that money some kind of initiatives that have more of a statewide effect. It doesn't necessarily mean that money is going to go to all these things, but that it will affect policy that will affect everybody. So that's a good thing. So we think the building is going to be built, but a report just came in yesterday saying that they didn't think it was justified. So we'll see. But I think DPH personally is trying to set up this system so that it's fair and equitable. It recognizes that there are some places that don't get any DON funding now. So my guess is it wouldn't surprise me if they come up with something where a certain percentage of every DON goes into a statewide fund of some
Right,
kind.
and if you remember, David,
Yep.
when we first started meeting as a statewide CHNA, that was something that we brought into discussion.
Right.
Specifically for areas that didn't have a lot of DON funding coming in, that we talked about creating a certain proportion, this is before the new regulations came about, but it's creating a certain proportion that would go into a pot so that communities that weren't getting DON funding, because would be able to utilize that, because we recognize that making good health in one little segment of the community and ignoring a whole other segment of the community isn't really a good thing. So we did have among the CHNAs, we did have agreement on that,
Yeah.
but I don't know how much weight that has.
No, but I think this is a moment where there's a mechanism to voice your opinion, and I would encourage you to do that. We're going to have to move on unless there's a pressing question.
Can I just